Let us put ourselves in the holy presence of our Lord. Our dearest Heavenly Father, thank you for making all things possible. We are grateful for all the blessings you are pouring upon each one of us, despite the challenges we are all currently facing. Thank you for blessing us today with the wonderful opportunity to meet virtually and learn together in the awesomely exciting webinar. May your blessings of wisdom and guidance be upon us, all through the sharing and impartation of knowledge and skills by our resource speakers, facilitators, and moderators. May all of us learn together, upgrade our competencies, and capacitate us to be the help in the development of our learners' lives and communities in the spirit of your love and generosity. May we now humbly commit every part of this webinar to you as we all bring you the glory, honor, and praises for your kingdom and holy name's sake. All this we pray in the precious name of our Lord and Savior Jesus Christ. Amen.
Through the dreadful darkness, we shall lead the light and lead a path to wisdom. Our will to be our lives. To those in pain and suffering, we shall hear a call. With arms to care and comfort, compassion above all, to face a brighter future, bound in unity. The Philippine College of Physicians, we shall be hand in hand, building a stronger nation.
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, presents its bi-monthly lay forum to promote the advocacies and mission of the college and its component and affiliate societies. An avenue of accurate and up-to-date conversations with the media and the general public, with timely and diverse topics covering vital public health and medical information, straight from the experts. In a platform that is convenient, accessible, and highly engaging. Welcome to the PCP Health Forum.
Good morning. Good morning, everyone. Thank you for attending today's PCP Health Forum. So it is an exciting day today because we'll have a new topic, to discuss. Okay. I am Dr. John Paulo Vergara. I will be your moderator for today's event, and I am a member of the PCP Media Communications Committee. Okay. Just for to give you a slight or small rules lang for our event, we will have a separate question and answer portion at the end of the presentation of our guest speaker. So you can type in your questions there, no, and then I will read them through and ask them to our esteemed guest speaker after the presentation. So our topic for today is about leukemia awareness overview on leukemia manifestation and treatment. No, as a brief introduction for everyone. So the 2020 Globocan report showed that leukemia is the fifth leading cause of cancer-related death in the Philippines and the ninth most common cancer type, which with more than 5,700 new cases in 2020. In adults, diagnosis and management of leukemia can be quite challenging because of the following reasons. First, there are non-specific symptoms, no, such as fatigue, fever, and easy bruising, which are common and can lead to delayed recognition and diagnosis. Second, accurate diagnosis of leukemia is imperative, no, for a more effective and targeted treatment. However, diagnosis would involve complex tests such as genetic analysis and molecular studies, which in the Philippines is not readily accessible, especially in most areas of the country. Also, the tests are expensive. And lastly, there are limited number of hematologists in the country, no? So we're still in need of more blood cancer specialists. So we must equip our primary healthcare physicians in recognizing, diagnosing, and the initial management of leukemia. So today's health forum by Dr. Eric Talavera would provide the important information to enhance our awareness and confidence in the management or primary care management of leukemia in our clinics. So for our welcoming remarks, I present to you Dr. Ricardo Batak. He is a fellow of the Philippine College of Physicians and associate member of PSMO. He is the PCP Board of Regent for Southern Luzon and the chair of PMA CPD Commission, and is also the hospital administrator and head of the Department of Medicine of Metro Lemery Medical Center. I now give you Dr. Batak.
Hey everyone, I'm Dr. Rick Batak, the PCP Regent for Southern Luzon. Today, I thank all our attendees for joining us and our hardworking PCP Secretariat for our PCP Health Forum on Leukemia Awareness, overview on leukemia manifestation and treatment to be delivered by our hematologist, Dr. Eric Roy Talavera. I am sure that you will gain additional knowledge after his lecture. Once again, welcome and hope that you will have a good time listening.
Thank you, Dr. Batak, for the welcoming remarks. Now I present to you our esteemed resource speaker for today's health. So I now give you or present to you our esteemed resource speaker for today's health forum. So our speaker is Dr. Eric Roy Talavera. He is a fellow of the Philippine College of Physicians and a diplomate of the Philippine College of Hematology and Transfusion Medicine and of the Philippine Society of Hematology and Blood Transfusion, and also a member of the Philippine Medical Association. I now give you Dr. Talavera.
Leukemias are a unique and diverse group of blood disorders requiring special care and management. It is currently one of the top cancers in our country. The month of September has been designated as the Leukemia Awareness Month in honor of our patients who are currently battling this disease. Good day to everyone. I am Dr. Eric Talavera, a hematologist or Doktor sa Dugo, and for today, I will be giving a talk on leukemias, an overview on disease manifestation and treatment. The term leukemia originated from the Greek words leukos, which means white, and haima, which means blood. To explain it in the most simple way, it is a cancer of the blood or cancer sa dugo, and mostly affecting our white blood cells. Like with all cancers, a mutation occurs in the blood which causes an abnormality in the renewal, proliferation, and differentiation of the blood cells. If you are a Marvel fan, having a cancer is like becoming a mutant in X-Men. But instead of having a special power that can make you strong, you develop an illness that can cause problems in your body. Given that we are in a health forum, I will also be presenting some common facts versus myths concerning leukemias. Afterwards, I will be providing a short discussion and eventually an answer to these statements. Our first facts versus myths statement is that leukemias are always genetic. Our patients may say, wala naman po kaming lahi ng leukemia sa pamilya, kaya hindi ako magkakaroon nito. Leukemias can affect anyone, although by incidence, it is slightly more common among men or sa mga kalalakihan. It can occur at any age, with a higher frequency being seen in the elderly, especially in the 6th to 7th decade. Risk factors that may increase the chance of a person getting a leukemia includes long-term chemical and radiation exposure, chemotherapy for other kinds of cancers, chronic smoking or paninigarilyo, obesity, and genetic or may lahi sa pamilya. However, most people who eventually develop leukemia do not have any of these risk factors. I would like to emphasize that association with these risk factors do not automatically mean that the person will have leukemia. And on the other hand, having none of these factors is also no guarantee that one will never develop the disease. So going back to our previous statement, this is definitely a myth or walang katotohanan. Leukemia is one of the most common cancers worldwide and represents 3% of new cases. It is also one of the top causes of cancer-related deaths with a similar percentage. Based on the latest 2020 statistics from the Global Cancer Observatory, leukemia currently is the top 9th cancer in the Philippines in terms of new cases, mostly among males, and is top 5 in terms of the number of deaths caused. Dahil isa sa mga top cancers ang leukemia sa Pilipinas, mahalaga na dapat ang bawat isa sa atin ay may kaalaman tungkol sa sakit na ito upang ito ay mabigyan agad ng karapat-dapat na lunas. This map represents the incidence and mortality of leukemia worldwide. As you can see, the incidence of leukemia in the Philippines is similar or a little bit lower than most countries. Our mortality rate is however more higher as compared with other nations as a whole, but with close similarity among our neighboring countries in Southeast Asia. The next statement for facts versus myths is that all leukemias act and behave the same, o lahat ng leukemias ay pare-pareho lang. There are different classifications of leukemia. Based on their behavior, we have two important classifications which are acute and chronic. Acute implies mabilis or agresibo ang leukemia, while chronic means mabagal or tahimik ito. Under acute leukemia, we have the main subtypes of acute myeloid leukemia and acute lymphoblastic leukemia, while for chronic, we have chronic myeloid leukemia and chronic lymphocytic leukemia. Ang pagiging mabilis o mabagal ng leukemia ay may epekto sa mga simptomas na maaari nitong maidulot at kung gaano tayo dapat maging listo sa paggamot nito. For our doctors here, another classification of leukemia is based on their lineage or origin, which can be broadly classified as myeloid or lymphoid. Determination of this is very important since the treatment options and medications are very different from each other. Hence, it is very dangerous to just label or put all leukemias in one big box and treat them the same. So going back to our previous facts versus myth statement, this is definitely a big myth or walang katotohanan. Our next fact or myth statement is perhaps a common one given the rampant misinformation. It says that people who bruise easily likely have leukemia. On the opposite end, our next statement is that people who have leukemia may not have any symptoms o wala silang nararamdaman. The symptoms of leukemia are not specific. To put it in a simpler way, ang mga simptomas ng leukemia ay pwede makita rin sa mga ibang sakit at hindi lamang sa leukemia. Commonly encountered symptoms include weight loss o mabilis na pagpayat, fever o lagnat, fatigue o matinding pagkapagod, shortness of breath o madali mahingal, headache and dizziness or pagkasakit ng ulo at hilo, bone pain or pananakit ng mga buto, bleeding and easy bruising o malakas na pagdurugo at mabilis na magkapasa, abdominal pain or pagkasakit ng tiyan, and early satiety o mabilis na pagkabusog. It is also very important that some leukemias can be asymptomatic o walang nararamdaman ang pasyente. Most of these are seen in chronic leukemias and they are incidentally seen during a blood test that was done for another reason, such as an annual medical exam, a pre-employment, or as workup for another medical condition. Going back to our third statement, this is definitely a myth or walang katotohanan. Easy bruising can be a symptom of leukemia, but having one doesn't automatically mean you have the disease. It is very important to consult a doctor in order to be properly evaluated. For this fourth statement, this is definitely a fact. Some patients who were found out to have a chronic leukemia actually were asymptomatic or discovered incidentally. As I have mentioned earlier, chronic means tahimik or mabagal, kaya posible talaga na walang nararamdaman rin ang isang pasyente na may ganitong klaseng sakit. The usual clinical signs of leukemias are directly related to the blood count abnormalities. Common signs include pallor o pagkaputla, petechiae and ecchymosis o mga pasa, skin nodules o mga bukol sa balat, palpable lymph nodes o mga malaking kulani, gingival hyperplasia o pamamaga ng gilagid, enlarged liver or spleen which can be palpated or seen in an imaging, and also the presence of recurrent or opportunistic infections. For our doctors here, I would like to present the common blood count patterns that can be seen in acute leukemias. The first set of patterns that can be seen are the presence of anemia or a low hemoglobin, thrombocytopenia or a low platelet count, accompanied by a variable white blood cell count which can range from a low to an elevated value, and the presence of an increased blast percentage in the differential count. Unusual blood count patterns that can also be suggestive of a leukemia will include the presence of cytopenias without any circulating blast in the peripheral blood as seen in the first column. These are called aleukemic leukemia and can mimic bone marrow failure states such as aplastic anemia and can only be diagnosed after performance of a bone marrow biopsy. Another uncommon pattern is seen in the second column wherein there's a marked elevation of the monocyte percentage accompanied by anemia or thrombocytopenia. This can occur since automated CBC machines can flag the myeloblast as monocytes. Therefore, If there is an unusually high monocyte percentage, the blood smear should be manually reviewed in order to confirm if this is a leukemia. Lastly, as seen in the third column, is the absence of any differential count and the remarks of suspicious atypical cells. These findings should not be taken lightly and can point to a leukemia. Hence, prompt referral and a manual review of the smear is urgently needed. For chronic leukemias, the common CBC patterns that can be seen are as follows. Findings suggestive of a chronic myeloid leukemia will include an elevated white blood cell count with a differential count showing various stages of maturation. This is accompanied by either anemia, thrombocytosis, or thrombocytopenia. The second set of pattern is usually suggestive of a chronic lymphocytic leukemia wherein there's marked leukocytosis with lymphocytic predominance accompanied by either anemia, thrombocytopenia, or both. Lastly, similar with acute leukemias, the absence of a differential count and a remark for atypical cells can also be seen in chronic leukemias and will require an urgent review of the blood smear. So after having an initial suspicion for leukemia, as physicians, how do we confirm the diagnosis? First and foremost, an early referral to a hematologist or a blood specialist is vital. A review of the complete blood count with morphologic examination of the smear will be done. If leukemia is highly suspected, a bone marrow biopsy is done in order to do confirmatory testing. If the patient is unstable, a peripheral blood sample can also be used. Confirmation of leukemia can be done using a routine histopathologic analysis. However, the turnaround time for this test may take long. At present, immunophenotyping in the form of a flow cytometry is done and can offer a relatively quick diagnosis of leukemia and its specific lineage. Cytogenetic, molecular, and mutational analysis is also done in order to aid in diagnosis, but most importantly for risk stratification and prognostication in order to guide treatment. Lastly, supportive tests that are needed include a blood typing, coagulation profile, renal, liver, and cardiac function, imaging in the form of a chest X-ray, ultrasound, or CT scan as indicated, and viral serologies, particularly for hepatitis, HIV, and SARS-CoV-2 virus. I have mentioned earlier about the bone marrow aspiration in biopsy. So what is it? It is an essential procedure in the diagnosis and monitoring of leukemia patients. Our blood cells are produced in the marrow, or commonly known as bulalo. Hence, this procedure will give the best sample for evaluating blood disorders. It is a minor procedure. It is commonly done as outpatient or in the clinic. The pelvic bone, or ang balakang, is the usual location since it is easily accessible and located away from major organs. The procedure is done under anesthesia to minimize pain, and a special needle is used to get the sample. It is a safe procedure if done by a trained physician with a very low complication rate. Common minor complications include pain in the biopsy site and bleeding, both of which can be easily mitigated. Lastly, there is no major incision in this procedure. Walang malaking hiwa or pagtatahi na kailangan, at ang sugat nito ay kusa na naghihilom. Our next statement for the facts or myths is that chemotherapy is needed to cure most leukemias. At present, there are a lot of modalities that can be used in treating leukemias. Most leukemias will require treatment except for the early stage chronic lymphocytic leukemia, which can be just observed. Treatment options for leukemias include chemotherapy, which can be given as a single agent or as a combination. These medications are available in different preparations and can be given orally, intravenously, or intrathecally. Immunotherapy in the form of conjugated antibodies can also be given as a form of targeted therapy for some leukemias. Cellular therapy in the form of a bone marrow transplant is highly useful to consolidate treatment for high-risk acute leukemias in the initial and relapse setting. CAR T cells are a relatively new mode of treatment wherein the patient's T cells is engineered or trained to attack his cancer cells. Lastly, radiotherapy may also be given, particularly for leukemias that have caused significant compression and mass effects in the brain, spine, and abdominal cavity. For the treatment of leukemia patients, the hematologist is the leader in directing the therapy. However, since most leukemia patients may also have other pre-existing medical conditions, a multidisciplinary approach with other specialties is also needed to provide the most holistic care. So going back, this statement is definitely a fact. At present, medicine is continuously evolving, and aside from the conventional chemotherapy, there are other options that I have previously mentioned that are currently being used in order to effect cure in our leukemia patients. Adjunctive or supportive care for leukemia patients is also vital. Blood transfusion is needed to keep the blood counts in a safe level to prevent any significant complications such as bleeding and cardiac events. Since most leukemia patients are immunocompromised, aggressive infection prevention and treatment is also needed. During their chemotherapy, they may also be prone to vomiting and mouth ulcers. Hence, we give the necessary preventive medications. The chemotherapies that are used for treatment may also cause complications in different organs such as the liver, kidneys, and brain. Hence, it is important to have an active multidisciplinary care. Counseling is also important for different aspects such as psychosocial, since being diagnosed with leukemia can cause a significant mental and emotional stress among the patients and family members. Nutritional support is also vital to keep the body strong during the time of treatment. Lastly, fertility counseling is very important because chemotherapy can affect their chances of having children in the future, especially for younger patients. If possible, egg harvesting and sperm banking can be done. Patients are also counseled not to get pregnant or impregnate their partners during the treatment. Overall, as I have previously emphasized, the care for leukemia should be holistic and proactive in order to promote a better long-term success. The goal of treatment in leukemia is highly variable and is dependent on the subtype, the age, the performance status or lakas ng katawan of the patient, and of course, the individual desire. As a doctor involved in cancer care, mahalaga na dapat pakinggan natin ang ating pasyente kung ano ang kanilang kagustuhan at galangin ang kanilang desisyon sa pagpapagamot. Depending on the treatment, our objective is to cure the patient or achieve a state or remission or to control it and prevent it from worsening. Overall, the goals of treatment will hopefully lead to a longer survival, a longer disease-free condition, and a better quality of life. Our last fact or myth statement is that all leukemias have a poor prognosis or outlook. The overall prognosis of leukemia is heterogeneous or paiba-iba, depending on several factors. The first is the behavior of the leukemia. Generally, those with chronic leukemias do better since the disease is less aggressive. The patient's profile is also a factor, with poorer outcomes seen among the elderly and those with other multiple medical conditions, as compared to younger patients with no known medical illnesses. The disease duration is also an important factor. In fact, the sooner that the patient is treated after being diagnosed, the better is the outcome. The genetic and mutational profile is also a predictor of the disease aggressiveness and can also help us decide on a form of targeted treatment. Lastly, the form of treatment is also a significant contributor to the overall outcome. Although initially very challenging to treat, cure and disease control is very much possible as long as the disease is treated early and the most appropriate treatment is given. So going back to our statement, this is definitely a myth or walang katotohanan. Not all leukemia patients have a poor outlook. Patients with chronic leukemia can enjoy a normal survival as long as taking the proper medications. Cure can also be achieved for acute leukemias as long as they are treated early and the most appropriate medications are given to them. The care of leukemia in the Philippines is really challenging despite the healthcare team's best efforts. The propagation of health disinformation is a barrier for patients to seek the right medical care and will usually lead to delayed treatment. Early recognition is sometimes difficult, especially if the disease presentation and laboratory findings are not typical. Health inequity is a major problem, especially among the less fortunate or those residing in far-flung areas wherein the proper specialists, diagnostics, and treatment are not available. The advanced treatment options and opportunity to participate in clinical trials is also lacking in our country. Hence, even the most well-off people will have to travel to a developed nation to get the necessary treatment. Financial constraint is also a significant factor, and perhaps ito rin ang isa sa mga common na ugat ng lahat ng problema sa wastong paggamot ng leukemia sa Pilipinas. Although the hematologist is the primary doctor in charge for the treatment of leukemia patients, the internist and general practitioner still has a vital role. As doctors in the primary care and frontline, they are important in the early suspicion and recognition of the disease, which will prompt referral to the hematologist. They are also integral in initiating the initial and emergent measures needed to stabilize the patient, as well as in promotion of accurate health information to both the patient and family, so that they may seek the most proper care. They are also needed in the multidisciplinary care, especially for patients with other medical problems, so that the hematologist can fully focus on the main treatment. Lastly, and for me most importantly, the internist is very important in the long-term care for our cancer survivors, especially in their surveillance as well as monitoring for long-term effects of chemotherapy to the patient. As a hematologist, I fully believe that a successful management of a leukemia patient is dependent on a good team of doctors that are actively engaging and involved. Napakahalaga talaga ng teamwork sa paggamot ng pasyenteng may leukemia. So we are now at the conclusion of our health forum. To summarize the important points that were discussed, leukemia is currently one of the top cancers in our country, both in incidence and mortality. The disease is highly heterogeneous and have different clinical behaviors depending on the subtype. The clinical signs and symptoms of leukemias are non-specific, hence an early referral to a specialist is desirable. A thorough investigation and timely initiation of treatment is vital in improving the overall outcome. Various treatment options such as chemotherapy, immunotherapy, cellular therapy, and radiotherapy can effect cure for our leukemia patients. The prognosis and outlook is highly variable and is dependent on the early and proper treatment of our patients. And lastly, a multidisciplinary care involving a good team of doctors practicing a holistic approach is of paramount importance. And with that, I end my discussion. I would like to thank everyone for listening. And in celebration of Leukemia Awareness Month, let us all keep in our prayers all the patients and their families that are facing this battle. Some will win, although more will also lose. But let us not keep this from breaking our spirit and instead use this to fuel our desire to help our patients defeat this disease. Lahat po tayo ay magkaisa upang matulungan ang ating mga pasyente na gumaling at maibalik ang maayos nilang kalusugan. Magandang araw po sa inyong lahat.
Okay. Welcome back. Thank you, Dr. Talavera, for your insightful and wonderful presentation on leukemia awareness. No, especially it is lean towards the primary care. No, for their recognition, easier recognition, and of course yung initial management. No, siguro we could start with the Q&A portion na ng
sir.
ating
Yes po, sir.
forum. So I'll start the ball rolling, no? Maybe I have my first question. So I maybe have touched on this a bit, but can we ask you if leukemia, with the general statement na leukemia daw, it cannot be cured?
For me, that's quite a difficult statement to make. Okay, so actually leukemia can be cured, and surprisingly, yung mga acute leukemias o yung mga agresibo o yung mga mabibilis, sila yung may paraan talaga para magamot. Okay, so if they're given aggressive chemotherapy, okay, and then binigyan ng karagdagang treatment, usually it's either another course of chemotherapy or bone marrow transplant or depende cellular therapy, they could achieve disease cure talaga or prolonged survival. Okay? Although it's very difficult talaga to say kung cure talaga kasi in our country we really don't have the best diagnostics to really measure kung meron pa talagang natitira yung mga pinaka konting leukemia cells sa katawan. Okay? Meron po kasing ganong examination and unfortunately right now hindi pa siya masyadong available in our country. For chronic leukemias actually, hindi talaga siya yung what we consider talaga na cured po talaga. Pero ang kaya natin gawin sa mga chronic leukemias is patahimikin sila or they're in a state of very, very quiescent or quiet sa katawan. Nandun pa rin yung mga abnormal cells, nagtatago pa rin, pero hindi na sila nagdudulot talaga ng kahit anong problema sa kalusugan. And to be honest, this kind of quiescent or tahimik is parang equitable or equal na to what we call like a functional cure. So overall, I really don't, it's really difficult to say that leukemias cannot be cured. Okay? Pero syempre, kailangan din natin maging maingat to explain it to our patients overall.
Okay, thank you for that. No, so for now I know we have the limitations, no, challenges in terms of
Yes.
the treatment. But yes, so I would have to agree naman, no, at least if we can help the patients na to have this state na quiescent, no, na tutulog lang, then at least we
Tutulog,
can have them.
tahimik.
Yes, so tahimik. We can have them, no, live the same ano mo yun, life na as everyone. Parang ganun, no? For our webinar attendees, you can still put on or type your questions in the chat box, and then so that we can have them read, no, and then forwarded here, and then ask them to our resource speaker. Dr. Talavera, another question. Are there any peculiarities ba in terms of our ethnicities as Filipinos with regard to prognosis at saka treatment response?
Right now, it's really difficult to say if there are any
Mm,
unique peculiarities as compared to, let's say, other ethnicities such as Caucasian or with our
mm,
nearby countries such as in uh, Japan or other Southeast Asian nations, since as of now, we don't have yet a large or a good database talaga po for our leukemia patients. Although this being done or this being tried to develop yung database in order to get more accurate information. But from where we trained po, where I came from in a government hospital, so we found out that leukemias usually in the Philippines, especially mga acute leukemias, are more commonly seen in a relatively younger age group as compared to what's being said in textbook na usually 60s or 70s. We see a significant proportion being diagnosed as early as 20s or 30s. And to be honest, medyo hindi namin nakikita yung male predominance. Sometimes, to be honest, medyo mas madami pa nga yung mga female na leukemia patients namin okay, as compared to males. In terms of their treatment response, it's actually quite difficult kung yung peculiarity ng response dahil dun sa ugali ng leukemia of Filipinos or maybe because of other factors. Because what we have to understand is yung delayed treatment talaga or delayed recognition can sometimes affect talaga yung overall outcome or response to treatment. Kasi the more na hindi nagagamot or napapabayaan yung leukemia, the more na nag-mutate siya or lalo siyang lumalakas, kaya mas madali niyang labanan yung chemotherapy na kaya nating ibigay. And lastly, yung options rin natin for chemotherapy here in the Philippines, although we have available yung mga standard or basic, pero yung mga mas advanced or yung mga pwedeng gamitin pag hindi na gumana yung mga initial na binibigay, medyo limited din kasi yung meron po tayo here in our country. So, isa rin yung malaking factor at pwede rin talaga maka-apekto sa overall outcome.
okay, thank you. So, magandang ano yun, no? Leaders no, for research tong ano, no? Tong Filipino ano, at least we can have our own no na database or yan, no? Saka baka meron kasi for example here sa atin in the colorectal cancers, no, we have seen different or mas bata, different behavior, no, in terms of colon cancers dito sa atin, ano, na baka may something different nga in terms of our ethnicity. We have a question from our online attendee, no. Siguro it's a sort of a review na lang based doon sa presentation mo kanina. But if we are already suspecting leukemia for a patient, this is a question, what are the initial diagnostics we can order already other than your peripheral blood smear before we refer to a hematologist?
Okay, so apart from CBC, yung mga examination or test na kailangan natin gawin, una, syempre kailangan natin i-blood type kasi usually all leukemias, initially lalo na yung mga acute, bagsak yung bilang ng dugo nila. So kailangan ng pagsasalin. So kailangan talaga malaman yung blood type para alam kung ano yung pinakawastong dugo na isasalin sa kanila. Other test para ma-measure is kung nagkaroon na ng epekto yung leukemia sa mga iba't ibang organs, especially yung sa kidneys. Kasi minsan yung leukemias, pag sobrang taas ng bilang, pwede silang pumutok. Tapos yung mga chemical na ma-release nila, pwedeng ma-damage yung kidneys. So kailangan maganda ma-check rin yung mga kidneys, tsaka what we call yung mga electrolytes rin. Okay, pati rin po yung mga test po sa liver kung nagkakaroon na ng sira yung liver gawa ng leukemia kasi makaka-apekto rin yun kung ano yung pinakawastong chemotherapy na kailangan ibigay. Maganda rin ma-check yung status ng puso nila tsaka yung x-ray. Kasi po minsan po yung mga leukemia, lalo pag sobrang bagsak yung dugo, pwede rin po yan magdulot ng heart attack. Okay? And syempre, kailangan matukoy rin po yun or mabigyan ng wastong lunas. Okay? Sa x-ray, kailangan makita kung merong infection or may nagtatagong infection. Kasi mahina ang immune system ng leukemia and lalo na po dito sa Pilipinas, laganap po ang tuberculosis. So importanteng malaman kung merong active or merong tahimik na infeksyon na nagtatago sa baga. Kasi syempre, kailangan muna rin yun mabigyan lunas bago ibigay yung chemotherapy kung hindi naman tayo sobrang nagmamadali. Importante rin na magawa yung mga ultrasound para ma-check kung mayroong mga nagtatagong bukol sa katawan or kung malalaki yung mga ibang organs tulad yung liver tsaka yung spleen. Kasi isa rin yung pamamaraan para ma-monitor kung gumagana po ba yung paggamot sa leukemia. Maganda rin ma-test yung mga importanteng viruses na nagtatago sa katawan, especially yung mga hepatitis kasi kailangan mabigyan rin ng karagdagang gamot habang binibigay yung chemotherapy. Since medyo tumataas na rin yung incidence ng HIV, kailangan rin yun matest and may nakita na rin kaming mga kaso before na sabay na merong HIV tsaka leukemia yung patient. So very challenging talaga pong gamutin po yun. And then lastly, although medyo patahimik na, maganda rin matest rin po for COVID-2 or SARS-CoV para at least alam natin na protektado rin yung doktor na dadaan tsaka hindi rin na rin natin may kakalat pa po yung ngayong tumatahimik ng pandemic.
Okay. Thank you again for that. Another question, Dr. Talavera. For patients who are undergoing work evaluation and was noted to have an elevated WBC but is asymptomatic, do we need to refer to a hematologist to clear the patient for work? Or is there any range or elevated level that is worrisome and would need further evaluation or would need referral to a hematologist?
Okay, so actually there is no specific worrisome level. Pero if we're really concerned, yung terminology na hyperleukocytosis, usually depende rin kasi yan sa what type of leukemia we have. Pero usually the standard cutoff we use is a WBC count of more than 100. So if you see a patient sa blood, sa incident sa pre-employment nila na more than 100, definitely you really need to refer that patient immediately to a hematologist in order to immediately work up. Pero kung asymptomatic sila, chances are mataas yung chance na most likely chronic lang ito. Kasi kung acute leukemia yan, tapos mataas na yung white blood cell count, may mararamdaman na sila usually and usually makikita natin sa mga ibang blood counts like yung hemoglobin tsaka yung platelet, mababa na sila. Pero kung chronic ito, minsan normal pa yung mga ibang blood counts eh. So maliban lang dun sa mataas na white blood cell. Okay? Pero kung sabihin natin medyo mataas lang ng konti pero less than 100, okay? Wala talagang specific na ano talaga na decision talaga, pero siguro best judgment na rin talaga nung doctor talaga. Pero sometimes kailangan din talagang ma-investigate kung ano yung nagko-cause ng mataas na white blood cell. Kasi minsan iniisip natin infection ba to? Pero kung walang infection, kailangan natin mag-isip ano pa ba yung mga ibang bagay na pwede mag-cause na tumaas yung white blood cell kung walang simptomas ng infection. Ang mga common dyan na kailangan nating tandaan yung mga paninigarilyo. Kasi actually yung mga patients na very heavy smokers, nakikitaan na mas mataas talaga yung white blood cell nila as compared to normal. Pero hindi siya usually tumataas ng more than 20 or 30. Isa pang common na pwede mag-cause na tumaas yung white blood cell na walang paliwanag tapos seemingly okay is usually nakikita rin po sa mga obese o yung mga medyo malalaki or yung mga matataba nating pasyente kasi yung mga fats nagko-cause rin yan na mag-secrete ng chemicals para tumaas yung white blood cell count. So kung yung white blood cell hindi naman sobrang taas, sabihin natin na sa mga 10 to 15 tapos na walang nararamdaman, pwede rin naman siyang i-observe. You don't need to refer it immediately to a hematologist. Pero kung ikaw as a doctor, meron kang pangangamba or meron kang apprehension or you just want to make sure, okay? To make sure na walang nami-miss. Ako as a hematologist, I will not fault you kung i-refer mo na yung pasyente para ma-evaluate and para ma-clear rin kung okay siya magtrabaho. Especially lalo na yung mga overseas na alam natin na matagal wala dito or yung mga seafarers na matagal na walang contact sa mga appropriate na health facilities.
Thank you for clarifying that. We have another question. Which chemotherapeutic drugs have been associated with leukemia? And how many years after chemo treatment can a patient present with leukemia?
Okay. So, yung mga common na for the doctors here, okay, so yung mga common na chemotherapy sa pwede mag-cause ng leukemia will fall under what we call yung mga alkylating agents. Okay? Mga good examples would be yung mga cyclophosphamide and such. Okay? And usually, pag mga alkylating agents, usually makikita yung leukemia in a span of 5 to 7 years. Okay? Pero in between, sometimes bago sila mag-progress to leukemia, nakikita na bumabagsak yung blood count sila or tumatawid sila dun sa isa pang condition sa dugo, yung tinatawag na MDS or myelodysplastic syndrome bago mag-proceed pa dun sa tinatawag na leukemia. Okay? Yung mga iba pang chemotherapy would belong to what yung mga other class, yung mga tinatawag na anthracyclines, like yung mga idarubicin, actually pati doxorubicin na ginagamit din for leukemia, pwede rin mag-cause rin yun ng secondary leukemia. Okay? Pati rin yung mga topoisomerase inhibitors, okay? Yun yung mga pwede mag-cause ng leukemia. And usually pag yung mga ganong classification, yung mga anthracycline tsaka topoisomerase inhibitors, usually mas maiksi yung interval. So pwede siya mangyari as early as 1 year to 3 years. And sometimes dumediretso na siya agad sa leukemia. Parang hindi na siya dumadaan dun sa tinatawag naming myelodysplastic syndrome na stage. Although yung mga nabanggit ko, yung mga na-mention ko, yun yung mga usual na time period. Sometimes it can happen at a longer period of time. Sometimes it can happen at a shorter period of time.
Okay. So those are important considerations, no? Especially katulad dun sa akin as my subspecialty kasi I'm a medical oncologist. So those are important, no? To consider, no? Especially when we are explaining to the patient the treatment options, mga chemotherapy,
Yes.
no? Because it can happen talaga. No?
And mas mahirap rin sila gamutin actually yung mga leukemia na may risk factor for previous chemotherapy. Nakitaan na mas poor yung risk
This is,
factors po nila.
yes,
Yeah.
I have to agree. No? Dr. De La Vera, you have briefly mentioned bone marrow transplant kanina, no? Can you expound on a little in terms of the procedure and yung cost, no?
Okay. Okay, so just a disclaimer po, hindi rin po ako transplant specialist. So meron po tayong group of hematologists here in the Philippines at what we call mga transplanters or transplant specialists. So sila talaga po yung handle po talaga ng mga pasyenteng kailangang mabigyan or ma-undergo ng bone marrow transplant. Pero in a nutshell, to summarize, yung bone marrow transplant, usually yung ginagawa sa leukemia is what we call yung mga allogeneic. Meaning merong isang donor na usually kamag-anak po, okay, na kukunin yung stem cells niya, okay, tapos ililipat yon doon sa pasyente para yung mga stem cells na yun, lalabanan niya yung leukemia nung pasyente. Okay? Pero bago kasi gawin yung transplant, kailangan masigurado na at least kahit paano maganda yung match nung donor dun sa recipient. Kasi pwede yung recipient pwede niyang ma-reject ma-reject yung ibibigay na stem cells. Pero kasi dito sa Pilipinas, actually medyo mahirap na maghanap talaga na 100% match kasi nakaka-apekto rin kasi yung pagsasali ng dugo, lalo na kung hindi siya yung what we call yung leukoreduced. Although medyo malalim na itong pag-uusap, pero kung hindi kasi leukoreduced yung blood product na binibigay, mataas yung chance na magkakaroon ng antibodies yung taong nasalinan at pwede yun mag-cause na hindi siya 100% match. Pero pwede rin naman actually magbigay ng transplant kahit hindi 100% match. Yun yung mga tinatawag naming haploidentical, yung mga ganung bagay. Okay? Pero usually, pag yun yung bibigay, okay, kailangan merong conditioning, meaning merong karagdagang gamot na ibibigay po doon sa recipient para at least tanggapin niya ng maayos yung ibibigay na stem cells. And then after nun, after mabigay yung bone marrow transplant, usually naka-admit po yun, tapos i-observe yung pasyente kung kakapit o yung tinatawag na nag-engraft yung mga stem cells na ibibigay sa kanya at kung magkakaroon ng mga reaction. Kasi yung mga ibang reaction pwede mangyari ng mabilis, yung acute, yung iba naman chronic o yung mga pangmatagalan. And then usually binibigyan din sila ng gamot pag sabi natin, kumapit yung transplant, binibigyan sila ng mga anti-rejection drugs para hindi rin nila ma-reject yung sinalin o yung binigay na stem cells sa kanila.
Okay. Medyo no for but yeah, no, medyo technical but yeah.
Yeah.
So it's one of the treatment options that we can have, no, even sa iba naming pasyente, no, sa here in
Yeah,
medical oncology, no,
yung mga
bone,
germ cell po, pwede yun.
yes, oo. We also refer sa inyo
Apa, apa. Tsaka
for
lymphoma, sir.
further treatment, oo. Um, Dr. Talavera, in terms of access, kasi syempre nabanggit natin kanina, no, limited lang kasi yung number nyo, no, sa Pilipinas, no, to actually care for our patients with leukemia. Is there an online portal where the patient can have info about leukemia sa inyo, or they can search for yung near na hematologist sa area nila?
Okay. Sorry about that. I am not, sorry po, I am not 100% sure. But as far as I know, yung website po namin sa Philippine College of Hematology and Transfusion Medicine is really ina-update na siya ngayon. Tsaka dinedevelop na by our team of doctors at the church. And one of their parang gusto nilang gawin doon is parang meron na talagang directory talaga doon na mga
Mm.
all of the hematologists in our country tsaka yung kanilang place of practice. So hopefully, pwede rin yun din yung magamit not only by our doctors who are practicing in far-flung areas, but also by our patients. So kung habang hindi pa siya ayos, to be honest, we can also use naman po yung mga social media platforms po, okay? Some of our doctors are very active po sa social media. So makikita yung mga names sila ng mga hematologists sila. And meron din po yung mga telemedicine clinics like yung mga like yung mga sa PPD, okay, or yung mga serious MD. Sometimes you can also search na rin doon yung mga subspecialty. So with that, you can also reach out to a hematologist relatively easily na rin po at this era of social media and technology.
Yeah, you're right, no? So we can take advantage of the social media platform. It's just important lang na alam natin yung sift through, piliin yung tamang information. Yun lang
Yes,
talaga
yes.
yung
Yes po,
magiging
sir.
challenge. But yes, it's a powerful tool. No, we can, maybe for our last question, Dr. Talavera, for our indigent patients, do we have any access sites for treatment na pwede nilang mapuntahan, no? For their, I know this is relatively costly na ang management, no? Especially sa dami ng blood transfusions minsan na kailangan, and then yung mga treatment, no? So do we have any of those in the country?
Yes, actually, we have important access sites, particularly limited po sa mga government hospitals, okay? Especially the larger government hospitals in the country, okay? Yung mga may mga magandang access, especially yung mga nasa metropolitan area or yung mga nearby areas. So with that, patients can avail of free access to medications. Magandang example, yung mga for chronic leukemias or CML, they can avail yung mga imatinib, yung mga ganong klaseng gamot. For sa mga acute leukemias, pwede rin sila maka-avail ng mga free chemotherapies and then also free consultation na rin tsaka management na rin sa mga doctors. Especially po yung mga government hospitals natin po that have training programs or merong mga tinatawag naming hematology fellows. So sila po ay although they're still training, maganda rin yung kanilang qualifications na they're adequately trained and we are also very confident na kaya naman nila i-manage po or gamutin din po yung mga ating mga leukemia patients na medyo indigent or kulang talaga sa pondo. And pwede rin nila matulungan po yung mga pasyente na yun na makakuha ng mga access or mabigyan po ng mga karagdagang discounts sa mga importanteng test na kailangan gawin po.
Okay, ayun. I think this is it, no? So maraming salamat, Dr. Talavera, for being our...
Sir, sa ano po, sir? Sorry, sa Q&A, okay pa po ba to? Or ubasa po yung time? Sorry. Or meron
meron pa ba tayong question?
Yes, sir. Sa Q&A po, sir, meron po.
Sure. Siguro isa na lang.
Okay, sige po, sir.
How do we deal with fertility issues among patients with treated for leukemia? Very important. Sige.
Yeah. Okay, so I previously mentioned it earlier kasi sometimes, well, kahit kami rin naman po as hematologists, sometimes we really forget it kasi nakafocus talaga kami on treating the patient. Pero syempre yun naman talaga yung primary goal, buhayin talaga. Pero sometimes you have to consider ano yung mga pwedeng maging long-term effects. So kung mga younger patients talaga, especially na sinabi ko before na dito sa Philippines, we can see leukemia patients as young as 20 or 30. So for those na wala pang anak or may balak magkaanak in the future, we give them counseling talaga na yung chemotherapy can affect your capability talaga to procreate or to conceive in the future. Kung meron silang kakayahan po or meron silang enough na funds, pwede silang i-refer po uh, sa mga reproductive endocrinology specialist para at least ma-counsel sila kung paano maitatabi yung mga samples sila, specifically yung sperm banking tsaka yung mga egg harvesting. Although personally, sa medyo limited ko pa lang naman pong practice, especially sa mga government hospitals, wala pa akong na-encounter na patient na nakapag gawa ng ganun kasi it's still also an expensive test. Pero for me, it's really important talaga na ma-counsel talaga sila para at least they're also well aware na kung ano yung pwede maging long-term effect ng chemotherapy sa kanilang capability to conceive or to have children in the future.
Okay, thank you for that. No, tama. No, it's a very important issue. No, yung fertility issue. Sa amin din when we, especially yung mga young patients,
Yes.
no, na mag-undergo ng chemo. So we have, it's been ano na ngayon, parang a paradigm na shift na to inform them of may options, no, to preserve fertility. No.
Yes, sir.
So yun. So thank you, Dr. Talavera, no, for
Thank you
your time and for being our resource speaker for today's health forum. Okay, so to give to present to you our welcome, our open closing for a doctor for closing remarks. Here's Dr. Hasbin Reyes Igama, which is our co-chair for the Committee on External Relations and the PCP representative for PhilHealth's Diagnostic Related Group. Here's Dr. Igama.
Good morning. In behalf of the Philippine College of Physicians and the Philippine College of Hematology and Transfusion Medicine, we would like to thank everyone for an important topic, leukemia awareness, the essence of which is presenting with common manifestations that are unrecognized. Takes a while before these patients come to us or even referred. Thank you, Dr. Eric Roy Talavera, for a comprehensive discussion, and Dr. John Paulo Vergara for facilitating this important topic. Congratulations, thank you, and have a good day, everyone.
Thank you, Dr. Igama. Now, before we end, we will just have some announcements. No? Can we flash them? Okay. This coming Saturday, we have this PCP sa Radio Veritas. No? And our topic will be heartbroken ka ba? Alamin ang mga sintomas at dapat gawin kapag pumapalya ang puso. And our resource speaker is Dr. Lauren K. Evangelista. So it's on Saturday, September 23, 9 to 10 a.m. And our anchors would be Dr. Agnes T. Cruz for PCP and Father Vong Torino. Next. Okay, last for tonight, we have this event on Specialista para sa Bayan with our speakers Yusek Kenneth G. Ronquillo and Dr. Imelda Mateo, to be moderated by Dr. Romel Punong Bayan and Dr. Carmela Rosan Remotique. It's tonight at 6 p.m. So you can have one PCP-CPD unit when you attend. So flash also the QR code where you can scan to register. So that's all. Thank you everyone for attending this health forum for today. See you next week. Thank you very much.
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, wishes to thank its media partners, social media followers, and participants. See you again next time, here on the PCP Health Forum.